Up until a few months ago, 49-year-old Eric Berg would have struggled doing something as simple as sitting down for breakfast with his fiancée, Tina. That's because he was experiencing up to 200 seizures a day.
It started when I was 12.
Living with seizures is something Eric has done most of his life. He says for 36 years, his seizures were small, infrequent, and easy to hide, which he did.
I was a kid, I was scared, and I didn't like it. So I learned to live with it, the 8 to 10, 12, maybe I had that a year, because they weren't really that bad. They weren't hurting me.
But in April of 2020, things changed.
There was a point that I told Tina, I said, I think I've had more seizures in the last couple weeks than I've had in my whole life. It was getting to the point where I was like, okay, this is my brain, something's wrong.
When Eric came to Mayo Clinic in June of 2020, he thought he was experiencing anywhere from 50 to 60 seizures a day.
When I finally came here, they told me it was a lot more than that, around 200-ish.
It was very clear he was having very frequent seizures, about 12 an hour.
Mayo Clinic neurologist Dr. Britton.
Eric was found to have a growth in the back left part of his brain, which is a fairly common cause of medically intractable focal onset epilepsy.
Dr. Britton says surgery wasn't a good option for Eric, and medications to stop the seizures weren't working.
And so the question then is, what can we do to help this patient?
Dr. Brian Lundstrom was brought in to see if Eric would be a good candidate for an emerging treatment for seizures called TMS.
So TMS stands for transcranial magnetic stimulation. So it's a form of non-invasive brain stimulation. And we have used TMS for other purposes. For depression, for mapping of epilepsy patients, but he was the first patient where we used TMS as a treatment for his epilepsy.
In June 2020, Eric received his first 5 TMS treatments.
It might have scared me a little bit more to know that I'm the first one to try something, but now, looking back, it was the best thing that's probably ever happened in my life, aside meeting Tina.
There was a noticeable reduction in seizures that occurred even in the initial few days of the treatment, and then they stopped.
Probably the last time he had any kind of a symptom was then June 24th.
June 24th was the last seizure that, I can recall. The last seizure activity that I had.
Eric returns to Mayo Clinic every few months for TMS.
The real benefit of something like TMS and non-invasive brain stimulation is just that it is such a low-risk approach, so that even if it only helps a minority of patients, we think that it may be a reasonable option for many patients.
It is a beautiful day.
It is a beautiful day.
It's a gorgeous day.
For Eric, it feels like he has his life back, and is looking forward to all the new opportunities this treatment has given him.
I don't feel scared about things. I don't worry about having a seizure.
And every day that goes by that he doesn't have a seizure is a victory.
For the Mayo Clinic News Network, I'm Dee Dee Stephen.